welcome, and thank you all for joining this morning for Mississippi Department of Mental Health's monthly training. Just this quick meeting notice here. Just note that this meeting is open to the public and is being recorded. So anything said or set in the chat during the meeting may be part of the public record. If you do have questions, you can use the Q&A function, and I would just remind folks to please mute themselves. Thank you. And we are actually also going to be using the chat function for some interactive exercises throughout the training today. So again, thank you all for being here. So glad you could all join us. You can go to the next slide. So today's training is on best practices for hiring mobile crisis response team members. And I want to welcome you all. My name is Kim Williams. I am a principal consultant with Health Management Associates out of our New York City office. For those of you who don't know, Health Management Associates, also known as HMA, we are a national health and research consulting firm, and we primarily focus on improving the administration and delivery of public health, healthcare, and social service programs. And HMA is just really thrilled to be partnering with the Mississippi Department of Mental Health and its efforts to enhance the state's crisis response system. And we're partnering on two major components. One is by providing these monthly trainings online for the crisis response continuum, and also monthly convenings that you are all welcome to join. And I will talk more about that at the end. So just a little bit more about me and my background. I am a social worker by training. I have over 20 years in the behavioral health space, including a number of years in behavioral health crisis. And I'm just really thrilled and excited to be here with you all today to talk about best practices for hiring mobile crisis response team members. So we can go to the next slide. Okay, so we have 4 learning objectives that are going to guide our time together. First, we're going to talk about some of the essential competencies and traits that are required for effective mobile crisis response work. And then we're going to spend some time talking about hiring practices that are really going to help to broaden access to qualified candidates. We're also going to focus on how to conduct behavioral and situational interviews that are going to help you assess candidates' decision-making and crisis management abilities. And then finally, we're going to spend some time talking about how to consider long-term cohesion, burnout prevention, and staff support when making hiring choices. Okay, I'm going to the next slide. So to ground us all, I want to talk for a few minutes about why mobile crisis teams matter. You know, mobile crisis teams play a really vital role in transforming how we respond to behavioral health emergencies. Their presence helps to shift the focus from one that is historically focused on punishment to treatment and care. And so first, we know, right, they reduce reliance on law enforcement. You know, law enforcement has been a default responder to mental health crises. Mobile crisis teams offer an alternative, right? They train professionals who can de-escalate situations and connect individuals to appropriate services. They also provide trauma-informed, community-based care, right? These teams meet people where they are, both literally and emotionally. They bring compassion, cultural responsiveness, and clinical expertise directly into people's homes, into a variety of community settings, helping to stabilize people. And 3 is they improve outcomes for individuals in crisis. So by being able to respond quickly and appropriately, mobile crisis teams help to prevent hospitalization, incarceration, as well as further trauma. And they support recovery and stability, and often in the least restrictive setting as possible. So ultimately, mobile crisis teams are really about centering safety, dignity, as well as connection. And they represent this really important shift in crisis response toward a more humane and effective response system. Okay, go to the next slide. So I want to spend a few moments just highlighting Mississippi's mobile crisis response team staffing requirements. So Mississippi's Rule 19.4 outlines the staffing requirements for mobile crisis response teams, also known as MCER. These standards are designed to ensure that teams are equipped with the right mix of expertise and lived experience to be able to respond effectively to behavioral health crises. So the first listed here is the requirement around a certified peer support specialist professional. This team member, right, they bring lived experience and they play a vital role in helping to build trust, in offering emotional support, and also modeling recovery. The second one listed here that's required is a licensed and/or credentialed master's level therapist. And so this clinician provides, assessments, crisis intervention, as well as clinical oversight for the team. The third is a community support specialist. This is a role that supports individuals in navigating services, maintaining stability, and also accessing resources post-crisis. And then the fourth required team member is a crisis coordinator. This is an individual that oversees the team's operations within the agency's catchment area. So they actually have to be a licensed or credentialed master's level therapist with at least 2 years of crisis response experience. And then the fifth required team member listed here is one that has to have population specific experience. This is a team member that has to have experience in training and crisis response for each population served. So whether that's mental health, intellectual developmental disabilities, and or substance use disorders. So you see from these staffing requirements, right, they reflect Mississippi's commitment to really building a multidisciplinary team that is clinically sound, culturally responsive, and community centered. Okay, we can go to the next slide. All right, so we're going to now move into objective one, which is all focused on defining the ideal mobile crisis responder and looking at core competencies, traits, as well as lived experience. Next slide. All right, what skills matter most? We think about hiring for mobile crisis teams. It's really essential that we look beyond just credentials and experience. We need to be thinking about how we identify candidates who bring a specific set of competencies that align with the demands of the work. And so let's walk through each of these. The first one noted here is a competency around crisis de-escalation and safety planning. So we should be thinking about candidates that demonstrate the ability to remain calm, to assess for risk, and also use techniques that help to reduce tension and promote safety for everybody who is involved. The second one noted here is emotional regulation and resilience. As you all know, this work is emotionally demanding. And so we want to be thinking about looking for people who can manage their own stress, who can maintain composure under pressure, and also who can bounce back from difficult situations. The third is a focus on trauma-informed care. So, understanding how trauma affects behavior and communication is really critical. And so we want to be thinking about recruiting team members who are able to approach individuals both with empathy and also avoiding re-traumatization. The fourth is cultural humility and responsiveness. We are serving diverse communities. Staff need to be open to learning from others, acknowledging and being aware of their own differences, and also adapting their approach to meet unique cultural needs. And then fifth is communication and collaboration. As you all know, crisis response, it's a team effort. And so strong communication skills and the ability to be able to collaborate across disciplines and also with community partners is really vital. So all of these competencies really form the foundation of a responsive, effective, and compassionate crisis team. And so they should really be central to how you think about and approach screening, interviewing, and onboarding new hires. Okay, next slide. So now we want to move on to talk about core traits of an effective mobile crisis team responder. So while the competencies, they reflect what someone can do, the traits reflect how they show up in the work. And these core competencies are really essential for building trust, for navigating complexity, and also for sustaining impact in mobile crisis response. And the first one noted here is empathy. Empathy is, critical because it allows responders to be able to connect with individuals in crisis, validate, their experiences, and offer be able to support individuals without a judgment. The second is emotional resilience. This work is intense. It's often unpredictable. Team members need to be able to manage their own stress and also recover from difficult encounters without being overwhelmed. And third is adaptability. We know that no two crises are the same. So having flexibility in thinking, in communication, and also in response is really key to being able to meet people where they are. And then fourth is integrity. Trust, which you're going to hear me mention a number of times, this is something that is built through consistency, through honesty, and also through ethical decision making. And so integrity really ensures that responders uphold the values of the team as well as the community. And these traits they're not always easy to measure, right? But they are often what makes the difference between a good hire and a really great one. Okay, next slide. Now we're going to highlight and talk about the value of lived experience. Um, Lived experience is one of the most powerful assets on a mobile crisis response team. And there are a number of important components here. One is that lived experience helps to build trust with clients, right? When someone has walked a similar path, whether through having experienced their own mental health challenges or substance use issues, or even just navigating complex systems, they really can connect with clients in a way that feels authentic and validating. They also help to enhance the team perspective. Lived experience brings insight that clinical training alone can't offer. It helps teams understand the real world impact of policies, of services, of language. They also promote representation, right? Hiring individuals with lived experience helps ensure that crisis response teams reflect the communities that they serve. It's a step towards dismantling stigma and also promoting inclusion. And then lived experience also helps to support and reinforce recovery-oriented care. People with lived experience often model hope and resilience, and so their presence reinforces the message that recovery is possible and that healing can happen in community. So ultimately, lived experience, it's not just a valuable asset, it's really essential as part of mobile crisis response teams. It helps to deepen empathy, it helps to strengthen relationships, and also helps to improve outcomes for individuals in crisis. Okay, now we're going to move on to a brief poll. And so I'd like you to just take a moment and respond to the following prompt in the chat. And that is, what's one trait or experience of a crisis responder that you have seen make a real difference in crisis response work? And I will just give you a moment to think about that and to respond directly in the chat. All right, it's been coming in. Empathy, teamwork, being calm, compassion, mentioned a couple times, empathy. Meeting people where they are. Yeah, staying calm, thinking outside the box. It's great. Ability to convey hope, empathy, and resilience. Being calm, teamwork. These are terrific. All things that we've talked about are really critical for these roles. Dedication. Thank you. Oh, solution focused. That's great. Thank you all for sharing your perspective here. And feel free to keep bringing them in as I continue on. And glad that the ones that you've mentioned, are reinforced in our messaging here. We're going to move on to, oh, I see somebody just noted one. Listening non-judgmentally. Yes, that's terrific. It's so important. Okay, I'm going to move on to objective 2, which is all about um, thinking about how we build a comprehensive hiring process and really promoting broad recruitment for these roles. You can move on to the next slide. So we're going to start by highlighting where non-objectivity can show up in the hiring process. When we think about non-objectivity in hiring, it's not always intentional, right? But it can show up in subtle ways, perhaps that we're not even aware of throughout the hiring process. And so recognizing these points of vulnerability helps us build a more impartial and inclusive approach. And so we're going to walk through each of these. So the first one listed here is right at the start of the hiring process with the job posting and the potential for exclusionary language. So language that's in the job posting that's overly clinical, academic, potentially culturally narrow, it can discourage qualified candidates from applying, especially those who have lived experience or non-traditional backgrounds. The second is around outreach. We're outreaching for these roles. There's the potential for exclusion of certain groups. So if we only advertise through mainstream channels, right, we may miss candidates from marginalized communities or those connected to grassroots organizations. When we go through the process of screening resumes, perhaps we might make assumptions, based on background. Non-objectivity can creep in when we make assumptions based on someone's name or their education, or perhaps they have gaps in employment, or we make assumptions based on previous roles that they've had. These don't always reflect a person's ability to succeed in the role. And then we move on to interviewing. And talking about unstructured or inconsistent questions. When we have an interview process that varies from candidate to candidate, it can be harder to compare responses fairly. So, structured interviews can help reduce non-objectivity and improve reliability throughout the process. And then in the interview process, when we have panel reviews, if we have lack of difference among panelists, so, homogeneous panels, they may unintentionally favor candidates who reflect more of their own experiences or communication styles. So more varied panels can bring broader perspectives. And then in the reference checks process, over reliance on informal networks. So depending too heavily on either personal or informal references can reinforce existing predispositions and potentially exclude candidates who lack access to those networks. So it's by identifying, these points throughout the entire process that we can take proactive steps to help reduce non-objectivity and also ensure that our hiring practices reflect the values of fairness, of inclusion, and also effective community responsiveness. So let's move on to the next slide. So then what can we do to counter this, right? What can we do to ensure that we're taking a different process with hiring when these things come up? Um, and I would say, when we're thinking about hiring, right, it's not just about filling a position, right? We're thinking about really building a team that reflects the values and the needs of the communities that we serve. So first, thinking about broad job language, right? So we want to start with inclusive, accessible job descriptions, avoiding jargon or overly clinical language that may discourage qualified candidates with lived experience or those non-traditional. The second is community outreach. So we want to be thinking about partnering with local organizations, trusted community partners that can help us to reach candidates who may not be actively job seeking, but bring valuable insight and connection. And then we want to use structured interview processes. So using standardized questions, as well as scoring rubrics that can help to reduce partiality and ensure consistency across all the candidates that we're interviewing. And this also helps focus on competencies of the job, right, and values as well, rather than personality or background of the individual. And then we want to think about implicit attitude training. So we want to be sure that we're training staff to recognize and address those unconscious preconceptions. We know that cultural humility and self-awareness are really key to making fair and informed hiring decisions. And then we want to have that broad hiring committee, right? Expanding our interview panels, including individuals with different roles, backgrounds, perspectives, as well as lived experience to ensure a more balanced and impartial evaluation. So these are all strategies that can really help you to ensure that hiring decisions are not only fair, but also we're really aligned with the long-term sustainability of the mobile crisis team, as well as help to build further community trust. Okay, now we're going to move on to another poll. Okay, so again, just respond in the chat to this question. What is one change you've either made previously or you would like to make to increase objectivity in hiring? Could be related to something that I mentioned or perhaps something else that you have done to improve objectivity in hiring. I'll give you a moment to think about it. I'm going to change the language on the job posting. Thanks for sharing that, Brian. I can share that I've changed job. I've done a number of these things, including thinking about language and job posting, broadening the hiring committee, having a structured interview process. And I would just say, so things have made a real difference in the hiring process. Oh, accepting more college interns for positions. Yeah, that's great. We'll keep them coming in. Think about changes either you've made or you'd like to make and to increase objectivity in the hiring process. Welcome you to continue to respond in the chat as we continue on. Thanks. Okay, so we're moving on now to talking about community engagement in hiring. So hiring for mobile crisis teams should be a community-centered process, right? When we engage the communities we serve, we help to build trust, we help to increase relevance, and we also strengthen our teams. And so there's a few things highlighted here in terms of community engagement. One is to partner with local organizations, which I noted earlier. Community organizations often have deep relationships. They often have credibility in the community, and partnering with them helps us to reach candidates who are connected, who are trusted in the community, and also invested in the community. So if you're not already partnering with local organizations, that's something to be thinking about. The second is including community voices in panels, in the hiring panels or interview panels. So bringing community members into that interview process helps to ensure that hiring decisions reflect the local community, they reflect local values, and also the lived experience and realities of individuals being served in the community. It also signals to community members values around being transparent and also ensuring accountability. And then you want to be thinking about recruiting from within the communities served. Hiring people who either live in or who have strong ties to the community promotes cultural responsiveness. It also helps to further build trust in the community, and it helps teams navigate local dynamics more effectively. And so community engagement, it's certainly a recruitment strategy, but it's also demonstrates a real commitment to ensuring representation, to fairness and shared ownership with the community in terms of crisis response. Okay, we can go to the next slide. Okay. So I want to spend a moment just talking a little bit about legal and ethical considerations, which are things you're probably already thinking about in terms of the hiring process. But as we work to build effective mobile crisis teams, we just want to ensure that our hiring practices are both legally compliant as well as ethically sound. And so the first consideration here is around ADA compliance. So wanting to ensure that job descriptions, our interviews, workplace accommodations, that all of them align with the Americans with Disabilities Act, the ADA. This includes making reasonable accommodations for candidates with disabilities throughout the entire hiring process. We also want to consider fair chance hiring. So we want to consider applicants who have justice system involvement. This is, especially when their lived experience aligns with the role or aligns, with the community that we're going to be serving. And then we also want to be thinking about confidentiality and boundaries. So we want to be mindful of how personal information is handled during the hiring process. We want to ensure that we respect candidates' privacy, especially when, discussing lived experience, for instance. And we want to avoid asking questions that could be discriminatory or intrusive. And so, legal compliance is really the baseline. Ethical hiring goes even further. It's about creating a process that is fair, that is respectful, and that's also aligned, with the values of mobile crisis teams, which are trauma informed and person centered care, and is really reflected throughout a number of the recommendations throughout this training. Okay, we can go to the next slide. So now we're going to dive into effective screening strategies. Before we even get to interviews, we want to be thinking about how we can build out a strong screening process that is going to help us to identify candidates who are most likely to succeed in the role. And so here are some considerations that you can think about including in your screening process. The first is a pre-screening questionnaire. And so this would be a short targeted questionnaire that focuses on questions around assessing their availability, to their comfort level with field-based work. And three is just basic alignment with the role. This is really going to help filter out any candidates who may not be ready for the demands of the position. And so you see an example question here, right? Are you comfortable responding to crises in community settings, including homes and public spaces? So just an example of what you might include in a pre-screening questionnaire. A second one noted here is a values statement. So you might think about asking candidates to submit a brief statement about why they want to work in crisis response and also how their own personal values align with trauma informed, community based care. And so this is going to reveal for you their own motivations, as well as whether or not their values are aligned with the work and aligned with the mission. The third one noted here is a scenario prompt. So you might think about including just a short crisis scenario in the application and ask candidates, how they're going to respond to such a scenario. This is going to help you determine and assess for their judgment, their approach to empathy, and also communication right before you would bring them in for an interview. So it gives you a sense of how they were going to respond to a particular crisis. The fourth one noted here is community connection. So you want to think about screening for lived experience or even familiarity with the communities that are going to be served. As noted previously, right, candidates with strong community ties, often they bring a deeper insight and trust building capacity. So that's something you also want to be thinking about in pre-screening. Then there's also, thinking about a screening rubric. So you might use just a simple scoring rubric to evaluate applications based on key traits and competencies. So this is going to help you standardize the process and also reduce objectivity. And then the last one noted here is to conduct brief screening calls. This can help, an HR can help with this function if you have an HR team, and it can help to really clarify the initial fit by phone. So the reason we put these forward, right, is because the screening process is going to help you to save time and also overall improve the interview quality. And then it helps to ensure that when you're bringing in folks for interviews, you're bringing in the right people into the room. So this is just something you can think about as part of your screening process. Okay, we can move on to next slide. All right, now we're going to be moving into objective 3. And so here we're going to be talking about interviewing and selecting for team fit, and also thinking about long-term success of candidates. So this is right about balancing immediate needs with sustainable staffing. Okay. So when we are thinking about the hiring process, we actually want to be hiring with the future in mind. So we want to be thinking about hiring for team members, not just about, well, who can fill the job today, but it's also about who can grow with the team and ultimately sustain the work over time. And so here are a few considerations. First is thinking about team dynamics. So when we think about a candidate, we want to be thinking about their personality, communication style, the values they bring forward, and how that's going to complement the existing team. A good fit on a team really helps to strengthen that team, right? Strengthens collaboration, strengthens morale. So, good team fit is important. The second is prioritizing alignment over perfection. No candidate is going to be perfect, but focusing on who aligns with your mission, with your values, with the team culture, even if they need some skill development, right? So that's something to be thinking about here. You also want to be assessing for burnout risk. As we've noted, right, this work is emotionally demanding. And so looking for signs of resilience, for an understanding of self-awareness, and also healthy coping strategies This is going to be helpful as you're going through the interview process, right? Is looking for those signs. And then looking for a growth mindset. Candidates who are open to learning, who are open to feedback, as well as professional development, are going to be more likely to adapt and thrive in more challenging, evolving environments. And then the last one noted here is discussing support systems. So you want to be asking about how candidates seek support, how they manage stress, how they engage in supervision. These conversations are going to help set the tone for a supportive workplace. And so, again, these are all things to be thinking about when you are hiring candidates and you're thinking about long-term sustainability and hoping that they'll be sustained into the future. Okay, you can move to the next slide. Okay, so now we're going to talk about identifying the right candidates and things to be thinking about. So one of the most common challenges in mobile crisis hiring is turnover, right? Especially when new hires realize that, this role is it's not for me. It's not what I expected. So to prevent this, we need to be proactive during the recruitment process and also during onboarding. And so here are some things to be considering. The first is applicable experiences. So you want to be looking for candidates that have relevant field, community, or lived experience. Examples could, include previous work in outreach or in peer support and behavioral health, or even direct, service roles that are in high stress environments. So we'll be looking for that applicable experience. And the second is offering a realistic job preview. So be clear and transparent about the nature of the work. You might consider sharing examples. Maybe you have videos or testimonials that reflect the emotional intensity, the unpredictability, and really field-based demands of the role. Being upfront about the demands of the role is really important during the hiring process. You also want to use scenario-based interviewing. So you want to include real-world scenarios real-world scenarios and applications or interviews to help candidates be able to visualize the work and assess their comfort level. So the example listed here is, right, you arrive at a scene where a person is pacing and shouting. What do you do first, right? You get a sense of how a candidate is going to respond in that scenario. You also want to use value-based screening. You've heard me mention values and alignment with values throughout this training. And so you want to screen for alignment with core values. And so, for example, you might ask, what does cultural humility, mean to you in a crisis setting, to get a sense of whether or not an individual's values are going to align with the values of the team and the mission of the organization. You also want to encourage self-reflection before hiring. So, for instance, providing candidates with a checklist or a reflection tool to help them evaluate their readiness for the role. So a couple of examples here of questions that you might ask are, how do you handle unpredictability? Or what support systems do you rely on? Giving you a sense of, how they might respond to these kinds of questions is going to help you to get a sense of their own self-awareness. The next one noted here is around, clarifying expectations during the onboarding process. So you want to use the onboarding time as a time to revisit role expectations, to answer any, outstanding questions, and really just create a space for honest dialogue about the role and the demands of the work. This can help new hires really feel informed and supported during the onboarding process. And then the last one noted here is coming back to, involving peers in the hiring process. peer-led interviews or shadowing opportunities, right? They allow candidates to hear directly from those who are doing and engaged in the work. It helps to build that trust component. It also gives a more authentic view of the role. And so, when we help candidates understand the realities of the role, the demands of the role before they start, we can help to reduce early exits and build stronger, more resilient teams. Okay, so moving on to our next slide here, we're talking about interviewing and selecting for team fit. Um, interviewing for mobile crisis teams requires more than just checking qualifications. It's about understanding how a candidate's going to show up, how they're going to contribute to the team, how they're going to respond under pressure, and whether or not their values align with the mission. And so here are the key areas that you want to be exploring. First one noted here is emotional regulation. So, example question: tell me about a time when you had to stay calm in a high stress situation. This is important because, right, we know crisis response demands composure and clarity under pressure. And second one is team alignment. So sample question is, what does collaboration look like to you in a crisis setting? We know this matters because strong teams really rely on those shared values, that mutual respect. So team alignment is really important here. Reinforcing the team component is building a complementary team. And so you might ask, what strengths do you bring that would complement an existing team? And this is this is important because hiring for balance and diversity of skills ultimately strengthens the team dynamics. You also want to be looking for communication style. So you might ask, how do you adjust your communication when working with someone in distress? We know that on mobile crisis teams that clear, compassionate communication is really essential in de-escalation and also in building rapport. And then we want to be looking for that flexibility and adaptability. And so we might ask someone, describe a time you had to change your approach really quickly. What happened? What did that look like? This is going to help you to understand their adaptability, capabilities. We know that crisis work is unpredictable, and so adaptability is key. And then we want to look for commitment to fairness. And so you might ask, how do you ensure that your work is culturally responsive? We know that mobile crisis teams, they serve diverse communities. And so we need to be thinking about how we approach and care for individuals with both humility and respect. And then looking at the experience that they have, you want to look for experience with serving adults, with serving youth. And so you might ask about that directly. Can you share with me your experience with working with youth, adults, or both in crisis situations? And this is important because different populations require different approaches. And so this is going to help you assess for versatility as well as age-specific competencies. And then noted here is skills with special populations. So you might ask a question around, do you have experience, working with individuals with disabilities or justice involved individuals or individuals experiencing homelessness? We know in serving diverse communities that specialized experience can really enhance responsiveness and also reduce barriers to care. And then we want to be thinking about language consideration, given the communities that we're serving. And so you might just ask, are you fluent in any other languages other than English, right? Language access helps us to improve service delivery and also helps to build trust with diverse communities. So those are all things to be thinking about in the interviewing process. These are all sample questions that you can build into your interview process if you don't already ask about each of these components. And these qualities often they emerge in interviews, scenarios, right, and in references, not just on paper. And so that's why it's so important to really design the hiring process that's going to reveal the full picture of a candidate. Okay, we can go into the next slide. All right, so some red flags to watch for. So, while we focus on identifying strengths and alignment during the hiring process, it's equally important to recognize potential red flags. And these are going to be indicators that are going to signal challenges with the team fit, with service quality, or potentially long-term sustainability on the team. The first one noted here is lack of empathy or cultural awareness. If a candidate struggles to demonstrate compassion or respect for different experiences, it may impact their ability to build trust and engagement with clients as well as with colleagues. So that's something you want to be looking for. The other one noted here is rigid thinking or resistance to feedback. Mobile crisis teams require flexibility and openness, right? We've talked about that. So candidates who show discomfort with change or feedback, they may struggle in dynamic team-based environments. And then the last one noted here is poor communication or teamwork history. Effective crisis response, right? Depends on collaboration. It's really critical. So if a candidate has difficulty communicating clearly or demonstrating that they're going to be challenged in working with others, it could affect team cohesion and client outcomes. And so these are all just things to be looking for. They certainly, they don't automatically disqualify someone, but they could prompt deeper exploration during the interview process. And our goal here, right, is to hire individuals who are not only skilled, right, but also have the self-awareness that they're adaptable and they're committed to growth. I think as we move to the next slide, we have another poll for you all that is going to come up. Excellent. Thank you, Rachel. So this question is, what's the most important factor when assessing a candidate's fit for a mobile crisis team? This is really just getting your perspective. Is it alignment with team values? Is it the ability to manage stress? Perhaps it's communication style. Is it flexibility and adaptability? Or is it a past experience in crisis settings? Curious for your perspective on this one. And thank you all for those of you who have responded already. Just give you all another moment to review this and consider your response. Anybody else? See a few more coming in. All right, I'm going to end it in just a moment. Welcome anybody else to respond if you want to. All right, I'm going to end it. Share the results. Okay, so you can see here that the top response at 35% is flexibility and adaptability. Yep. Being able to adapt in those high stress situations is really critical. Let's see, the next one that's tied is 20% ability to manage stress, and also past experience in crisis settings. Yeah, sometimes that past experience can be really helpful because they sort of know what it's like to manage in these kinds of settings. And then we have a few folks who noted communication style and also alignment with team values. Thank you all for taking a moment to respond to that and sharing your perspective here. All right. So Moving on to the next slide here, we're going to talk a little bit about onboarding. So, right, we've talked about the hiring process, talked a lot about right screening, interviewing, ensuring that we're identifying the best candidates for the role. Now we're moving on to onboarding because hiring is just the beginning, right? A strong onboarding process helps new team members really feel supported, prepared for the role, and also aligned with the work from day one, really. So here are some considerations for onboarding. One is ensuring a trauma-informed orientation. So we want to introduce new hires to the principles of trauma-informed care, emphasizing safety, trust, as well as empowerment for both clients as well as for staff. We want to provide them with the opportunity to shadow experienced team members, allowing new staff to observe seasoned responders in action. This can be really helpful. It helps to build confidence. It reinforces best practices. It also fosters mentorship. And then we want to be thinking about ongoing supervision and support. So regular check-ins, reflective supervision, as well as access to wellness resources. This helps staff, process their experiences as well as, stay grounded in the work. Team-based models of care. So wanting to emphasize collaboration, shared decision-making, as well as role clarity within the team in order to promote cohesion as well as to reduce burnout. And then thinking about cultural needs and support. So ensuring that onboarding includes training and dialogue around cultural responsiveness, language access, as well as community specific practices. So effective onboarding, it's not just about logistics. As you can see here, it's really about culture and reinforcing a culture of support and engagement. It helps to set the tone for how staff are going to engage with clients, how they're going to engage with others, and ensuring that they're fully aligned around the expectations of the role and aligned with the team. And the next slide, we're going to talk a little bit about retention and ensuring that we're keeping staff, we're maintaining them, we're helping them to grow. It's about, creating that environment where staff feel supported, they feel valued, they feel heard. And so in mobile crisis teamwork, this is especially important because we know the emotional intensity of the work and we know the unpredictability of the role. And so we want to make sure that we are supporting staff and helping to retain them. And so noted here are really some helpful strategies to support retention. So let's talk through them. The first is peer support and wellness programs. Crisis work can be isolating for folks. And so peer support groups, wellness check-ins, access to mental health resources that can really help staff to stay connected and also cared for. And so there's some examples listed here, weekly peer debriefs, offering mindfulness sessions, access to and reinforcing access to employee assistance programs. All of this can help to be supportive to staff and help them to feel less isolated in the work. Offering growth and development opportunities, staff are more likely to stay when they see opportunities and a future with the organization. And so some examples noted here are offering training stipends, offering a leadership development track, as well as mentorship programs. You also want to think about recognition and feedback and building a culture of that. It's important because feeling seen and appreciated, it really helps to boost morale and engagement of staff. And so some examples here are, monthly shout outs, right? Offering opportunities for providing feedback and looping back to that feedback. Offering staff appreciation events. All of these are helpful ways to build a culture of recognition. Supportive supervision. We know that supervision plays such a key role in staff retention and staff well-being. and reflective supervision creates a space for processing, for learning, as well as for growth. And so some examples noted here are just offering regular one-on-ones, trauma-informed supervision models. Those are things that can be offered. Also want to be thinking about workload and scheduling flexibility. Burnout often stems from rigid schedules and overwhelming caseloads. And so you might think about rotating shifts, flexible time off policies, manageable team ratios, and then team-based models of care, which fosters collaboration and shared decision making. And so, might provide cross-training to team members, daily or weekly team huddles, as well as shared decision making and care planning and crisis response. And then finally, cultural needs and supports, ensuring staff have the tools and training to respond to diverse cultural contexts. And so some examples are language access resources, providing ongoing training on cultural humility and community-informed practices. And so retention it's about keeping people, but it's also about creating that environment where people can thrive. And so when we invest in our teams, we strengthen our services and our impact. Next slide. So to know whether our hiring practices are working, we need to be thinking about measuring outcomes, not just outputs. Success isn't just about filling the role, but it's also about building those strong, sustainable teams that serve the community well. And so here are some things for you to be thinking about in measuring hiring success. Your retention rates, are staff staying long enough to build relationships and grow and contribute meaningfully? Team satisfaction. Do team members feel valued, supported, and aligned with the mission? Community feedback. Are the people that you're serving in the community, are they satisfied with the care that they receive? And then crisis outcomes. Are we seeing fewer hospitalizations, arrests, or repeat crises? Tracking, outcomes helps us understand the impact of our hiring decisions and on service delivery. And so by measuring success across these dimensions, we can then refine our hiring practices, ultimately strengthen our teams and ensure we're meeting the needs of our communities. Next slide. So just a final reflection for you all. As we wrap up today, I just want to invite you all to reflect on what you've learned and how you'll apply it in your own hiring practices. So just questions for you to think about. You don't have to respond. If you want to put something in the chat, I welcome you to do so, but this is really just for you. And thinking about what will you take back to your organization? How might it influence your next hiring decision? What's one change you'll make in your hiring process? Maybe it's rewriting a job description or modifying your interview panel. Small changes can really lead to meaningful impact. And then who can you partner with to improve fairness in the hiring process? Maybe it's a community organization. Maybe it's even an internal champion you have who you can collaborate with to make your hiring more inclusive. Hiring, for mobile crisis teams, it's more than just filling the role, right? It's about building trust, advancing fairness, and really creating teams that are reflective and serve the communities that we support. Next slide. So here are just some references for you to review, as well as to share with your teams. When you get these, slides, welcome to click on and review these references. Can help to be informative for you. And as we close out and go to the next slide, I just want to say thank you to you all. Thank you for your commitment to this work and to approaching it collaboratively and thoughtfully and intentionally. I also want to highlight, as I mentioned at the top of the training, our monthly convening of Mississippi Crisis System Partners. Our next one is on October 29th at 10 a.m. Hope you will join us. It's a wonderful opportunity to engage with partners across the crisis continuum. And this month we'll be focusing on the engagement of peers across the continuum. And then the next slide is just our upcoming trainings. Just want you to be aware of the plethora of training opportunities that are being offered for all of you. And I hope that you will take advantage of them. And then our final slide is just a reminder to follow Mississippi DMH on social media. It's an opportunity to engage and collaborate and also just to stay informed about all the wonderful events and training opportunities available to you. So thank you all for being here and have a great rest of the day.